Hey everybody, Randy Kurtz here for the ISB with Stretch of the Month. So I continue to get questions from you. I appreciate that. Please keep sending them. I'm getting to them as much as I can. We're trying to respond to your emails personally, so hopefully we're getting everything covered. Some of the things you're asking about have been in previous videos, so please check the ISB Body and Base archives, as it were, for the last several months, and maybe some of your questions may be answered there. But again, please keep the questions coming. We sure do appreciate it. So I had a question about lateral epicondylitis or tennis elbow, which is something that bassists tend to get. Tennis elbow has nothing to do, ironically, with playing tennis. Really, I've never seen ever anybody who played tennis that had tennis elbow. Nevertheless, it must have some basis in fact, for there it is. Lateral epicondylitis refers to the location of the inflammation, and itis is an inflammation, so this would be lateral, and this would be the area where extensor muscles of the forearm attach, extensor muscles. And these could be aggravated by playing the bass. For example, if you're playing a lot of pits, you can be playing like this, perhaps your hand going back a little more, or this arm into extension, or this arm being tighter in its musculature from being in the same position and doing the same repetitive motions. We talked last month about tightness of these carpal muscles within the bones of the hand here, and now this lateral epicondylitis is something that you'll have inflammation here from overuse of the extensor muscles. So a little bit of a break sometimes will help that out. If you have that and it's ongoing, a good treatment for that would be ultrasound, which is a modality which goes over the area, penetrates down, helps to reduce the inflammation. Anti-inflammatories can help. If you can go see a therapist or a massage therapist, you can get the extensor muscles and the flexor muscles of the forearm worked on, which means they'll go and work on those muscles in such a way as to relax them, which will take pressure off of and pulling off of this area, which can cause the inflammation in the first place. Another quick fix, especially during or after a gig, is you can take a Dixie cup or a small cup, fill it with water, freeze it, tear off the top inch or so, and you'll have something that will be a nice applicator for cold without having to put ice right on there and make that be on there and make everything tighten up, which is something that then you have to deal with the tight musculature again, which is what we're trying to relieve. So again, take a little cup, fill it with water, put it in the freezer. When it freezes, tear off maybe the top inch or so, and you have a nice little applicator, and you can put that right on this epicondyle, and that will help to reduce the inflammation and take away some of the discomfort. So again, Randy Kurtz for the ISB. Thanks again for your questions. Please keep them coming, and you can always get my book, The Basis Guide to Injury Management, Prevention, and Better Health, from my website, drkertz.com. But again, you can always get it through the ISB bookstore, which you should, so you can support the organization. I also do Skype consults at the same web address. Randy Kurtz signing off until next time.